Hi, I'm Sarah Bernstein. I'm a clinical nurse specialist in GYN oncology, and I'm here to talk to you today about all the different side effects that potentially you're going to experience while you're getting your chemotherapy. So today we're going to talk about neutropenia. So first let's talk a little bit about how chemotherapy works. It's going to work at the cellular level, and it's going to work on all cells in your body from your head to your toes. And this means it's going to do damage to the good cells as well as to the bad guys. So they work fastest on all the cells that are dividing rapidly. That's why we have different regimens that'll change, whether it's a 7-day, 14-day, 21-day cycle. They're all different depending on which therapy your doctor prescribes for you. So the major side effects are all based on how the different chemotherapy agents exert their efforts on the particular cells in the body. So for example, some will cause hair loss, some will cause some nerve pain, and some will cause changes in the bone marrow or the blood. So as you can see from this cartoon, it shows you that it pretty much affects every system of the body. But right now, let's talk about neutropenia. That's how it affects the white blood cells. So chemotherapy damages the stem cells, and it decreases the ability of the bone marrow to replace the erythrocytes, the neutrophils, and the platelets. When we talk about a neutrophil count, that's a white cell count, or the absolute neutrophil count, anything lower than 1,500 is considered neutropenic. It's kind of a big word, but all it means is that your white cell count has gotten kind of low. I always like to think of it as if you're going to a ride and you have to be this tall to get on the ride, your white cell count now has gotten kind of low, and we know it's going to get lower when you receive chemotherapy. So we want it to be high enough when we start chemo so that when you receive it, if it drops a bit, you'll still be safe. We use the term nadir, and nadir means it's the lowest point after you've received chemotherapy where your white count's dropped to its lowest point. In general, it's between 7 and 14 days from the time you receive that chemotherapy. It kind of depends on which drugs you receive as to when that happens and how long that'll last. If this is the first time you've received chemotherapy, it tends to drop and come right back up, and sometimes we see it drop, sometimes we don't. But if it's the second, third time you've received chemotherapy, then it can actually come down and stay lower and then come back up. The very first ones to drop are usually the white cells and sometimes the platelets. Platelets, to me, tend to drop later on in chemotherapy, as the red cells can also drop as you've been going through your therapy at a longer period of time. Why do we have that happen? Well, the chemotherapy itself causes that. And if we also use radiation, radiation can also increase how low those white cells can go. The disease itself sometimes, that can also make your white cell count drop. And as we get older, our bone marrow isn't quite as robust as it was when we were younger, so that can cause that white cell count to drop and come back a little bit slower too. Your bone marrow, though, will never forget that you've received chemotherapy. That's an important concept because if, God forbid, you need to receive chemotherapy years down the road, your bone marrow will always remember that you've received the chemotherapy that you're going to receive now. So why do we worry about the white cell count dropping? Well, the biggest worry is that if your white cell count drops, you won't be as able to fight off an infection should one come along. So we define a fever as anything above 100.4, especially if you've hung on to that for an hour or two and it's still 100.4, or if you hit 101 just one time. One of the most common sites that people get an infection, well, it's just like anything else. You can get an upper respiratory infection, and that would be a fever, cough, shortness of breath when you start walking around. You can have infection of the skin or the mucous membranes. You'd see redness, some tenderness. The skin could get hot. You could have some swelling in the lymph nodes under your arms, or around your buttocks or your mouth, the perineal or rectal area. Those are all areas I want you to keep an eye on when you take your shower. You can have a urinary tract infection, which would include a fever, frequency of the urination, painful urination, or the urine could be cloudy or could have some blood in it. If we use an invasive device such as a central line, a catheter, you could have redness, pain, or tenderness at that site. You could have swelling, drainage, or redness again around the swelling of the site. So during the time that your counts are low, meaning that period between days 7 and 14 in most of our chemotherapy regimens, I want you to try to stay away from doing too much gardening. And if you do gardening, I need you to wear gloves and long sleeves in case you get scratched or pricked by any of the thorns. We tell you to kind of stay away from a lot of live plants and dirts just during that time when your counts are very low. A long time ago, we used to tell patients no fruits and no vegetables during the time that you're neutropenic, and we found out that really there was no good reason to take those things away from you. So what is important, though, is more about safe handling. So what I'd like you to do is wash things well. If you're going to eat a watermelon, wash it first before you cut it. Most of these things are just good common sense. So I generally tell patients stay away from anything that's in a sneeze guard. If your counts are low, I don't want you going to, any place that has salads underneath those big sneeze guards. We also take away things like sushi, raw meats, raw fish, those things, because we don't know how your body's going to respond to those things. You want to stay from people who've just had a vaccination with a live organism. This is where you get out of having to clean the fish tank or pick up the doggy poo or clean out the litter boxes or bird cages. So if those are things that are important to you, then you're going to need somebody else to give you a hand during the time that your counts are low. You need to stay away from people who have transmissible diseases such as chickenpox or herpes zoster, a flu, or even if they just have a nasty cold. It's important that when you see other people are always saying, what can I do? Good hand washing is extremely important. So washing your hands well frequently and then using a good lotion, that's important too, because your hands and your nail beds can get kind of dry and cracked. It's important to take a shower every day. And I know this sounds like simple things, but when you don't feel well, sometimes the last thing you want to do is get out of bed and jump in the shower. But the number one cause of infection in cancer patients is their own normal body flora. So taking a shower and brushing your teeth are actually the two best things you can do for yourself. It's important to do mouth care before you do your meals, using a soft toothbrush, and good perineal care after voiding or having a bowel movement. You need to be careful also about trauma. That would be things like I was talking about in terms of the garden or scraping yourself and keeping an eye. Because if your white cell count is low, you're not going to necessarily see redness or pus at the site of those infections because you don't have enough white cells to mount up a response to that. So it's important to stay away from things like getting catheterized, no enemas, no rectal exams or rectal temperatures, and no tampons. It's important to also be real proactive about constipation. If your stool gets very firm or very hard, then that particular aspect could cause a tear in the rectal area, and that's another great source for infection. If you're on the skinny side, then making sure that any of those bony prominences, your elbows, your buttocks, your scapula, those get rubbed every day with some good lotion, and make sure that none of those sites are getting red or broken down. Don't shave your head when the hair starts to fall out. Don't want a Yul Brynner look. It's important to use just an electric clipper, and you can buzz your hair off, but never shave the head. You want to promote the healing on wounds by using dressings or open to air as needed. If you're going to have intercourse, it's important to use a water-soluble lubricant. Although we would recommend that you avoid intercourse when your counts are very, very low, but if you are going to have intercourse, be sure to use a good water-based lubricant. Silicone can be kind of tough in terms of getting in the shower. It can become very, very slippery, or the bathtub. So if you get a fever of 100.4 and you still have it an hour later or 4 hours later, I need you to call. If it's still there for 4 hours or you don't feel well, then I need you to report to the closest emergency room within an hour. If you have shaking chills, what we call rigors, you have painful urination, trouble breathing, you're putting up a lot of congestion and sputum, those are all things I'd like to know about, and pain. So daily showers, brush your teeth twice a day for 90 seconds using a soft toothbrush. And if the doctor's prescribed the long-acting drug Neulasta or Neupogen, which you would take every day, you would start that 24 to 36 hours after the chemotherapy has completed. So if you are going to be taking that shot, do you feel comfortable with giving that injection to yourself? If not, make sure your nurse and you have a lengthy conversation about how to do that. So, as a cancer patient, and you and your family also would need to get a flu shot. It really doesn't matter what time of year you're going to get your flu shot, but this is when we're going to do this at the best time when your blood counts are at their highest. We don't use the nasal flu mist, and your family that lives with you, they should not be using the flu mist either because they use a live virus for that. Dental care is best to be done before you get started on your chemotherapy, especially when your counts are at their highest. But let's say you can't get in before your chemo. Frequently, if you call the dentist's office and tell them you're going to be starting chemotherapy, they'll try to rush you in for a cleaning. If you need to have anything done while you're on chemotherapy, the best time to get that done is right before you start your next cycle of chemotherapy when your blood counts are at their highest. And of course, if anything invasive needs to be done, such as pulling of a tooth or a root canal, you need to clear that with your physician before you go and have that done. So the number one way to protect yourself is, and your family can help you, is good hand washing using lots of good friction for 30 seconds, or saying happy birthday, not too fast, and using lotion. Well, thank you very much. Hopefully this has been helpful to you. Any concerns or questions, please talk with your oncology nurse or with your physician.